I'm Charlie Milbert from the MD News Network. We're at the 2011 American Medical Association Annual House of Delegates meeting in Chicago, where we spoke with Dr. Cecil Wilson, the AMA's immediate past president. Dr. Wilson, thanks for joining us. You stated very succinctly in your opening address that moving forward is the only choice and the only option. How can the AMA continue to move forward toward that objective?
Well, we have several jobs ahead of us. One of them has to do with the implementation of the Affordable Care Act, getting things out of there that need to come out, things like the Independent Payment Advisory Board, putting things in that were left out, and that's medical liability reform, a fix for this broken Medicare physician payment formula, and then working with the administration, with Congress, as the rules and regulations are promulgated so that they benefit patients and physicians.
You reiterate the need for a permanent solution to sustainable growth rate formula. Which of the emerging payment models, some of the most common being ACOs, episode of care bundled payments, patient-centered medical homes, and gain sharing, which of these do you think holds the most promise?
I think the fair observation, we don't know. And that's why we're saying it should not be one model. And we believe there needs to be a flexibility of models because we're not sure which are going to work. And in addition, one model may work well in one part of the country and not in another. It may work well in one type of practice and not in another. So that's the reason these are models. They are pilots because we are not sure what's going to work best. And we do not anticipate it'll be only one. We expect it to be multiple.
You've been among the select group of physician leaders, consulted at the White House and on Capitol Hill when lawmakers seek to discern feasible solutions for the challenges facing health care. To what topics have you devoted the most time and energy during the past year?
You know, it's been really a potpourri of things. I've spent a fair amount of time revolving around the proposed regs on accountable care organizations, meeting with people in the administration. Also have spent time on the SGR, and most recently last month testified before the House Subcommittee on Health on that subject. And then I guess the third area that I've actually been working on over the last couple of years has to do with the changes in federal kickback laws, antitrust laws, and so I have interacted a fair amount with the Federal Trade Commission and the Department of Justice, saying that for physicians to be able to work in these new models, to work together in ways they've not been able to do before, we're going to need some changes, some protections for them revolving around antitrust and things of that sort.
What are the strongest attributes of your successor, Dr. Carmel?
Well, Dr. Carmel has had the same kinds of experiences we all have in working on the board. Dr. Carmel has an appreciation of the practice of medicine. He comes from an academic background, but he adds to that an understanding and sympathy for those physicians who are out in the trenches in clinical practice. He is a direct, straightforward kind of a person with a lot of practical good sense, and we're going to be well served by his term in office.
I see. What challenges and opportunities do you expect to see the AMA face in the coming year?
Well, the big challenge, it does have to do with the implementation of the Affordable Care Act and the various ramifications of that. Now, related to that, but and slightly separate, has to do with the issue of the workforce shortages that we have in this country. For health system reform to work, it is going to require more physicians. We have an aging population that needs more health care. We have the baby boomers who've just come online starting this year. And in the coming 2 years, we will have some 32 million more Americans who have insurance. So access problems will be a challenge, and so we're going to need to work on workforce issues to make that difference. The other, which is an initiative that the AMA just kicked off last year, and that is to look at our whole education system and bring it up to a level to meet the needs of 21st century medicine. We realize we're operating on a system over the last number of decades that has worked well, but does need revision to meet workforce needs and to meet different educational needs of physicians as they practice medicine now.
If you had to distill the AMA agenda into a couple major areas of focus, what would those be?
Because the reality is that the AMA has responsibilities for our profession and for patients in this country. That's a big responsibility, and there's a lot on the plate. And so we will be focusing on a variety of things, and so there's not going to be any one thing that we'll be involved with, but clearly our focus will be on making a healthcare system that is better for physicians and the patients they serve. We also have a focus, since we are a membership organization, on the needs of our physicians, our fellow physicians. We just rolled out a web portal that will help them in their practice, electronic health records, health information technology, and a variety of things of that sort. When we survey our physicians, they say, I need help in my office. We know that our advocacy role is very, very important, and in addition to that, they need help, and we will be focusing on that as well.
Thanks for watching this MD News Network special report, and a very special thanks to our guest, the AMA's immediate past president, Dr. Cecil Wilson. To comment on this or any MD News video report, see the comments section below the video player on mdnews.com. This is Charlie Milburn. Thanks for watching.